Mitral annulus is A. Circular, B. Elliptical, C. Saddle shaped, D. None of the above. Correct answer C. Saddle shaped. Mitral annulus is not a planar structure and has three-dimensional saddle shape. The shape of mitral annulus can change with annular dilatation as occurs in left ventricular volume overload. Barlow's disease is A. Bicuspid aortic valve, B. Mitral valve prolapse, C. Coarctation of aorta, D. None of the above. Correct answer B. Mitral valve prolapse. Barlow's disease is due to an excess myxomatous tissue in the mitral leaflets with accumulation of mucopolysaccharides. The mitral leaflets are bulky and redundant, prolapsing into the left atrium during systole. Mitral valve prolapse causes varying degrees of mitral regurgitation and is associated with a non-ejection mid-systolic click. Incidence of rheumatic fever is A. Declining worldwide, B. Increasing worldwide, C. Remaining unchanged, D. None of the above. Correct answer A. Declining worldwide. The incidence of rheumatic fever is declining worldwide, more so in developed countries. The reasons suggested are improvement in socio-economic conditions, better public health care, frequent use of antibiotics, and possibly a decrease in the virulence of streptococcal strains. The incidence ranges from 5.7 cases per thousand in worst affected regions to 0.3 cases per thousand in least affected regions. Pulmonary artery systolic pressure in mild mitral stenosis is A. Less than 30 mm of mercury, B. 30 to 50 mm of mercury, C. More than 50 mm of mercury, D. None of the above. Correct answer A. Less than 30 mm of mercury. Grading of severity of mitral stenosis from pulmonary artery systolic pressure can be as follows, though the actual grading is based on mitral valve area. Mild, less than 30 mm of mercury. Moderate, 30 to 50 mm of mercury. Severe, more than 50 mm of mercury. Mean gradient across the mitral valve in severe mitral stenosis. A. More than 10 mm of mercury, B. Less than 5 mm of mercury, C. Between 5 mm of mercury and 10 mm of mercury, D. None of the above. Correct answer A. More than 10 mm of mercury. Mitral stenosis can be graded according to mean transmitral pressure gradient as follows. Mild, less than 5 mm of mercury. Moderate, 5 to 10 mm of mercury. Severe, more than 10 mm of mercury. Transmitral pressure gradient can be measured non-invasively by Doppler echocardiography. Invasive measurement is by cardiac catheterization. A modified Rankin score of 2 corresponds to A. No significant disability, B. Slight disability, C. Moderate disability, D. None of the above. Correct answer B. Slight disability. Modified Rankin score has been used to score the disability after cardiopulmonary resuscitation regarding the neurological outcome. It was originally proposed for the outcome of stroke management. 0 score corresponds to no symptoms, while score of 6 corresponds to death or no possibility of return of spontaneous circulation. Score 5 is a bedridden, incontinent person who needs constant nursing care. Beta adrenoceptor desensitization is mediated by A. G protein coupled receptor kinase, B. Cyclic AMP, C. Alpha adrenoceptor, D. None of the above. Correct answer A. G protein coupled receptor kinase. G protein coupled receptor kinase activation is prompted by catecholamines. GRK in turn induces phosphorylation of beta adrenoceptors, leading to beta arrestin binding and G protein uncoupling, shutting off beta adrenergic signaling. This regulation system is called beta adrenoceptor desensitization and accounts for downregulation of beta receptors with prolonged catecholinergic stimuli as well as pharmacologically administered beta stimulants. Lorcaserin is an A. Antihypertensive drug, B. Anti-diabetic drug, C. Anti-obesity drug, D. None of the above. Correct answer C. Anti-obesity drug. Lorcaserin is indicated in those with body mass index more than 30 kg per meter squared or in those with 27 kg per meter squared and one additional risk factor like hypertension, type 2 diabetes mellitus or dyslipidemia. Which of the following is contraindicated in heart failure? A. Digoxin, B. ACE inhibitor, C. Beta blocker, D. None of the above. Correct answer D. None of the above. Although beta blockers will not be given in acute decompensated heart failure, chronic use of beta blockers in stable heart failure has been shown to increase survival. Other drugs useful in heart failure are angiotensin receptor neprilysin inhibitor ARNI, diuretics, and mineralocorticoid receptor antagonists. Patients with NYHA class 2 to 3 heart failure are more likely to die of A. Sudden cardiac death, B. Progressive pump failure, C. Non-cardiac causes, D. None of the above. Correct answer A. Sudden cardiac death. Patients with mild to moderate heart failure are more likely to die of ventricular arrhythmias rather than pump failure, while those in NYHA class 4 are more likely to die of progressive pump failure. But the mortality rate will be higher in NYHA class 4 rather than in class 2 to 3, and arrhythmic deaths do occur in class 4 heart failure as well. Commonest cause of syncope in the absence of structural heart disease: A. Ventricular tachycardia, B. Supraventricular tachycardia, C. Vasovagal syncope, D. None of the above. Correct answer C. Vasovagal syncope. Syncope is an important cause for visits to the emergency room, contributing to about 3% of emergency room admissions and 1 to 6% hospital admissions. Head-up tilt test is an important test for vasovagal syncope. Matrix metalloproteinase 3 is A. Interstitial collagenase, B. Gelatinase, C. Stromatolizin, D. None of the above. Correct answer C. Stromatolizin. Interstitial collagenase is MMP1 and gelatinase is MMP2. Matrix metalloproteinase 3 and other metalloproteinases are found in the shoulder region of vulnerable plaques and are important in the process of plaque rupture. Vulnerable plaques have a lipid-rich core and a thin fibrous cap, and they are prone for rupture. Rupture of a vulnerable plaque in the coronary artery causes local thrombus formation, leading to acute coronary syndrome and myocardial infarction. Which of the following is not a feature of vulnerable plaque? A. Thick fibrous cap, B. Large lipid-rich necrotic core, C. Increased plaque inflammation, D. Positive vascular remodeling. Correct answer A. Thick fibrous cap. Vulnerable plaque has a thin fibrous cap which is prone for rupture and consequent thrombus formation, leading to vessel occlusion. Depth of chest compression in CPR for an adult is A. 2 cm, B. 5 cm, C. 10 cm, D. None of the above. Correct answer B. 5 cm. The depth of chest compression in an adult is at least 5 cm or 2 inches. Adequate chest compression is the most important part of good quality cardiopulmonary resuscitation. Interruption of chest compression should be minimized during CPR. Survival in out-of-hospital cardiac arrest up to hospital discharge: A. 8%, B. 18%, C. 24%, D. 32%. Correct answer A. 8%. Out-of-hospital cardiac arrest has a very poor survival rate. Rates as low as 2% has been reported from Asia, while the rates from North America and Europe are higher. It can increase if bystander initiates CPR. Aspirin resistance is more likely to occur in diabetics due to A. Increased protein glycation due to hyperglycemia. B. Decrease in aspirin-mediated protein acetylation. C. Reduced sensitivity of platelets to aspirin. D. All of the above. Correct answer D. All of the above. These mechanisms act sequentially and contribute to relatively higher chance of aspirin resistance in diabetics. Mechanism of antiplatelet action of aspirin is by irreversible inhibition of COX-1 enzyme, thereby blocking the synthesis of thromboxane E2, a vasoconstrictor that promotes platelet aggregation. Clopidogrel is a P2Y12 receptor antagonist, B. GP2B3A inhibitor, C. Vitamin K antagonist, D. None of the above. Correct answer A. P2Y12 receptor antagonist. Clopidogrel, ticlopidin and prasugrel are P2Y12 receptor antagonists. GP2B3A inhibitors include apixaban, eptifibatide and tirofiban. Warfarin is a vitamin K antagonist. Best graft for coronary artery bypass grafting is A. Reversed saphenous vein, B. Left radial artery, C. Left internal mammary artery, D. None of the above. Correct answer C. Left internal mammary artery. Left internal mammary artery is the best available vessel for CABG. It has good long-term patency rate and provides a pulsatile flow. Saphenous vein grafts are prone for degeneration and thrombosis. Left radial artery being a free graft, unlike the in situ Lima graft, is inferior to Lima graft but probably superior to RSVG. Antiplatelet agent with reversible action. A. Prasugrel, B. Clopidogrel, C. Ticlopidin, D. Ticagrelor. Correct answer D. Ticagrelor. While prasugrel, clopidogrel and ticlopidin are thienopyridines, ticagrelor is a nucleoside analog with overall similarity to adenosine. As the action is reversible, it acts faster and shorter than clopidogrel. Hence, it has to be taken twice daily, while clopidogrel needs to be taken only once daily. But the reversible nature helps when the drug has to be withdrawn prior to surgery. Coronary artery disease is more common in diabetics than general population. A. 2 to 4 times, B. 5 to 8 times, C. 10 to 15 times, D. None of the above. Correct answer A. 2 to 4 times. Coronary artery disease occurs 2 to 3 decades earlier in diabetics than non-diabetics. Some even consider diabetes mellitus as a coronary artery disease equivalent. A pro-patent foramen ovale is present in % of adults. A. 5 to 10%, B. 12 to 18%, C. 20 to 25%, D. None of the above. Correct answer C. 20 to 25%. A pro-patent foramen ovale means a probe can be passed from right atrium to left atrium across the foramen ovale without actually resorting to septal puncture with a needle when you wish to enter left atrium during cardiac catheter interventions like balloon mitral valvotomy. Patent foramen ovale is less common than PPFO. Cerebral hyperperfusion syndrome is a rare complication described after A. Carotid endarterectomy, B. Carotid angioplasty, C. All of the above, D. None of the above. Correct answer C. All of the above. Ipsilateral headache, nausea, vomiting, focal seizures, and altered mental status are the features of cerebral hyperperfusion syndrome. Long-standing hypoperfusion due to severe carotid stenosis impairs the cerebral autoregulation of microcirculation. Sudden improvement of perfusion pressure after revascularization overwhelms the ability of dilated arterioles to constrict, causing the hyperperfusion syndrome. Carotid bulb is the A. Proximal dilated portion of the internal carotid artery, B. Proximal dilated portion of the external carotid artery, C. Proximal dilated portion of the common carotid artery, D. None of the above. Correct answer A. Proximal dilated portion of internal carotid artery. It is also known as carotid sinus and has a lot of baroreceptors involved in carotid sinus mediated syncope, carotid sinus hypersensitivity. Common carotid artery bifurcation is at the level of A. cricoid cartilage, B. hyoid cartilage, C. thyroid cartilage, D. none of the above. Correct answer C. thyroid cartilage. Common carotid artery usually bifurcates into internal and external carotid arteries at the level of the thyroid cartilage. Material used for bioabsorbable coronary stent is A. polyethylene glycol, B. polyvinyl chloride, C. polylactic acid, D. none of the above. Correct answer C. polylactic acid. It is completely degraded and absorbed by about 9 months. Bioabsorbable stents are called bioabsorbable vascular scaffolds. Which of the following is a microsomal triglyceride transfer protein inhibitor? A. Ancetrapib, B. Mipomersen, C. Lomitepide, D. none of the above. Correct answer C. Lomitepide. The formation of ApoB containing lipoproteins in liver and intestines are mediated by microsomal triglyceride transfer proteins. Lomitepide decreases total cholesterol, non-HDL cholesterol, ApoB, and lipoprotein little a. It has been approved by FDA for treatment of homozygous familial hypercholesterolemia. True statement about Mipomersen. A. Antisense oligonucleotide targeting ApoB. B. Reduces ApoB and total cholesterol. C. FDA approved medication for homozygous familial hypercholesterolemia. D. All of the above. Correct answer D. All of the above. Mipomersen can also be used in statin intolerant patients with dyslipidemia. It can cause fat accumulation in the liver and injection site reactions. The drug is given as weekly injections. Drug which blocks intestinal absorption of cholesterol. A. Atorvastatin, B. Gemfibrozil, C. Ezetimibe, D. Rosuvastatin. Correct answer C. Ezetimibe. Ezetimibe acts by selectively blocking the uptake of cholesterol and other sterols by intestinal epithelial cells. The action is on Niemann-Pick C1-like 1 cholesterol uptake receptors. Interestingly, it has been recently shown that NPC1L1 expression is necessary for hepatitis C virus infection. Ezetimibe can block the entry of HCV into the cell in experimental situations. True statement regarding bile acid sequestrants. A. Inhibit the absorption of bile acids. B. Depletion of cholesterol pool in the liver. C. LDL receptor upregulation. D. All of the above. Correct answer D. All of the above. They occur sequentially. In addition, they have a beneficial effect on glycemia, possibly mediated through incretins. Important bile acid sequestrants are cholestyramine, cholestypol, and cholesyvalum. Doubling dose of statin produces further reduction in low-density lipoprotein cholesterol by A. 3%, B. 7%, C. 25%, D. 50%. Correct answer B. 7%. Although the initial dose of statin produces substantial reduction in LDL cholesterol, doubling dose of statin produces further reduction of only 7%, known as rule of 7, possibly due to counter-regulatory mechanisms. Carvalho sign will be absent in tricuspid regurgitation if there is associated A. mitral stenosis, B. tricuspid stenosis, C. aortic stenosis, D. none of the above. Correct answer B. tricuspid stenosis. Carvalho sign is the inspiratory augmentation of TR murmur. When there is associated tricuspid stenosis, it prevents the inspiratory increase in flow to the right ventricle and the inspiratory augmentation of TR murmur. So, Carvalho sign will be absent when TR is associated with TS. Carvalho sign is useful in differentiating VSD murmur from TR murmur, both of which occur at the same location. It is named after the Mexican cardiologist Jose Manuel Rivero Carvalho, who described it in 1946. Presence of third heart sound is indicative of left ventricular dysfunction in A. Mitral regurgitation, B. Aortic regurgitation, C. Tricuspid regurgitation, D. Pulmonary regurgitation. Correct answer B. Aortic regurgitation. Presence of S3 is indicative of LV dysfunction in AR. In mitral regurgitation, presence of S3 need not indicate LV dysfunction, but it does indicate that the MR is severe. Signs of severe tricuspid valve disease: A. Elevated JVP, B. Severe dependent edema, C. Ascites, D. All of the above. Correct answer D. All of the above. Severe systemic venous congestion characterizes severe tricuspid valve disease, and all of the above are associated. Hill sign is seen in A. Mitral stenosis, B. Aortic stenosis, C. Aortic regurgitation, D. Tricuspid regurgitation. Correct answer C. Aortic regurgitation. Hill sign is a wide difference between the upper and lower limb blood pressures in severe aortic regurgitation, with the latter being higher. The difference increases with the severity of aortic regurgitation. Graham-Steele murmur is heard in A. Aortic regurgitation, B. Pulmonary regurgitation, C. Tricuspid regurgitation, D. Mitral regurgitation. Correct answer A. Pulmonary regurgitation. Graham-Steele murmur is heard in pulmonary regurgitation due to severe pulmonary hypertension, classically in severe mitral stenosis. Austin-Flynn murmur is heard in A. Aortic stenosis, B. Aortic regurgitation, C. Mitral stenosis, D. Mitral regurgitation. Correct answer A. Aortic regurgitation. Austin-Flynn murmur is the mid-diastolic murmur heard in mitral area in a case of severe aortic regurgitation. Prominent A wave with shallow wide descent in jugular venous pulse is a feature of A. Tricuspid regurgitation, B. Mitral regurgitation, C. Tricuspid stenosis, D. Mitral stenosis. Correct answer C. Tricuspid stenosis. Prominent A wave is due to the forceful right atrial contraction against the stenosed tricuspid valve. Shallow wide descent is because right ventricular filling during early diastole is slowed by the tricuspid stenosis. Water hammer pulse is seen in A. Aortic stenosis, B. Mitral stenosis, C. Mitral regurgitation, D. Aortic regurgitation. Correct answer A. Aortic regurgitation. Water hammer pulse is the high volume collapsing pulse of aortic regurgitation. It is associated with a wide pulse pressure. The collapsing nature is best felt with the upper limb raised vertically and held with the palm of the examiner's hand. Water hammer was a Victorian toy in which a tube was half filled with fluid, the remainder being a vacuum. Each time the tube was inverted or shaken, the impact of the fluid at each end would sound like a hammer blow.